Hello, today we are going to speak about a subject by name the Parkinson's disease. 11th of April every year is celebrated as Parkinson Day, and the whole of month of April is known as the Parkinson month. Though the disease was diagnosed by one gentleman named James Parkinson way back in 1817, you can understand why the day is celebrated every year since that time. Because the number of patients of Parkinson disease are increasing day by day, more so in major countries like China and India. Now we restrict ourselves to India. Now India, you will be surprised to know that there is about 15 to 45% per lakh population of Indians are developing this disease. And this is only increasing. Earlier the percentage prevalence is not so. And another important point, the Indian Parkinson disease patients, the disease is coming younger. And about a decade, that means about 10 years younger compared to the other people of the world. Say, generally it's known as the disease of the old, but it's not that old in Indian population. So people, when they are productive to the society, to their family, to themselves, itself they are falling prey to this disease. And also this disease is a spread across the country is also different. What is there in, say, in Kerala, what is there in Arunachal, what is there in Madhya Pradesh, they are different. One specific community in this country, that's called the Parsi community, are maximum affected. In spite of the richness of the digital media, social media and all, still the knowledge regarding Parkinson's disease hasn't yet percolated down to the last man in the society. That's why the diagnosis of Parkinson's disease, sadly, is getting delayed. When diagnosed delayed, treatment delayed. Treatment delayed, the recovery is slower. An important thing is the classical thing is teaching of Parkinson's disease is when we are students in 1972 and subsequently is that they have what you call tremor of the hands are stiff, rigidity, and akinesia, that is movement activity also they become slow. These are the triad, three signs. But that is by the time these three, tremor, rigidity, and akinesia is otherwise known as slow movements, they appear, they will be late. Now, the endeavor all over the world is for every disease, be it the heart disease, be it the brain tumor, be it Parkinson's, to diagnose early. So that requires a proactive and also a preventive action to prevent the disease and to diagnose the disease at an earlier stage. And in that direction, if there are some symptoms which even the household wife or children observe these symptoms, probably you can have a doubt so that you contact the doctor at the earliest. For example, the gentleman or lady is sleeping excessively in the daytime, excessive daytime sleep, or in the sleep there is disturbed, smell decrease, or total loss of smell. They are anxious, they are very depressed. And most important is, many a time they are constipated abnormally. Suppose they get up and going for the walking and all, suddenly they fall down, they feel dizzy. And when the doctor checks up, the blood pressure becomes low. They sweat a lot, excessive sweating. The memory is impaired, the gait becomes slow, and in addition to these features. Sometimes even the cognitive skills like the calculation, memory, differentiation, taking decision making, all these things are also affected. These are all early symptoms. The classical Parkinson's disease, what we talk about, the motor symptoms are, as I said, the tremor, rigidity, akinesia are in the deeper part of the brain by name the basal ganglia, and in that there is a part substantia nigra where the dopamine neurons are at less number. Now, as the science is advancing, we are talking about the involvement of the frontal lobe, we are talking about the involvement of the limbic system here inside, the cerebellum, and also the cranial nerves. As I said, the smell is because of the number 1 cranial nerve by name olfactory nerve. And also number 10 cranial nerve, vagus nerve, that is the gastrointestinal system affected. And the digestion is impaired. And also the memory, calculation, all these things are impaired because of the involvement of various symptoms. And the most important is, once the diagnosis is made, doing a PET scan and all, what you call a dopa PET scan is good, but that is a little late. Suppose there is some other way, there is one synuclein seed assembling assay. There is a new test has come. I believe this test is 95% sensitivity the moment you get it out. And this is coming slow into the usage. And there is another important thing called Parkinson smell test. You can ask me, what is the smell test? There is one lady who observed a peculiar smell in her husband's body from the sweat he was pouring out, mostly the sweat glands located in the neck. This is something like a musky smell, a very sweet, warm, strong smell. And later, when she visited the doctor and repeatedly she was bringing to the attention of the doctor, there is something different. The smell is coming different in my husband. And later it was found to be this Parkinson disease. So anytime the smell test, so-called smell of this sebum, and people now are going into the direction of taking a skin swab from the secretions of sebum, that is sweat, and that is also very high percentage positivity. So rather than going for the PET scan and waiting for the tremor and all, these small things, once you get it out, suppose the sleeping excessive, his performance in the office is not the same, he's anxious, he's not very much disturbed, he's constipated, morning he doesn't go for the walk, he's not mixing with his friends, and he's not the same as he was. There is change in his face, what is called mask-like face. There is a group of friends enjoying a drink, and they laugh and smile, but he doesn't laugh because the face doesn't show the expression. So this is the classical feature of what is called mask-like face. You wear a mask, your expressions are not seen, isn't it? So these small things make a big difference in the diagnosis. Once the treatment is this age-old treatment, that is in the form of carbidopa, levodopa combination, that is called syndopa or tidomet, these drugs. And once the drugs, the patients are lucky enough to diagnose early, they may be better off. And those who don't improve significantly, are resistant to the medical management, they may require even deep brain stimulation, a new surgical procedure where multiple electrodes are implanted into the area where the dopamine secreted, what we're talking about, substantia nigra basal ganglia, and the results are also very good. But please remember, surgery is surgery. There is no surgery without complication. The complications because of deep brain stimulation are recorded as infection, hematoma, and sometimes even weakness of the other side of the body. So all said and done, for any disease, the trend is to be today a proactive and predictive. That means you should predict that likely this person is likely to have it. Then try to prevent. And once you cross these steps, then there is a precise treatment to the individual, and that will result in personalized care. So all the 5 P's, proactive, and then preventive, predictive, precise, personal care. So ladies and gentlemen, even in Parkinson's disease, even after so many years, we are looking for the day when this sort of personalized early diagnosis in a proactive way will help. Thank you.